we've heard a lot already about the biology of these tumours. Do you think that, knowing what you know now, that some patients do get very aggressive cancers despite prevention strategies, despite early detection, despite the best treatment in the best centre, that the outcome still is not going to be good, whatever you do?
I guess if you say it like that, it sounds like prevention is not good. What I'm saying is that my wife took care of herself. She took care of her body. So I absolutely not smoking. It's a good thing, right? Absolutely. But that doesn't mean that you're not going to get lung cancer. But that would be great as it relates to prevention. Taking care of yourself. I mean, we know obesity right now is one of the biggest, right with smoking, one of the biggest indicators of cancer. So exercising, eating better, all these things that are going to make sure that you're, in terms of prevention, it's going to give you the best chance to not get cancer. But that doesn't mean you're not going to get it.
Now, I know that you're going to come on and describe a little bit more about the specifics of Keisha's story. Do you think, was she treated in a centre of academic excellence?
She was treated at Emory University in Atlanta.
So
yes.
She was treated by experts
yes.
in lung cancer. And when you talk to patients about advocacy, how important do you think that is at getting to the right doctors at the right time? Do you talk about that as part of your message?
Absolutely. I think it's important that they're able to get to the right docs. It's important to make sure that whatever is the top of the line treatment, we want to make sure that people can get to that. My wife got her mutation tested. She got her tumor tested. She did that. She was negative for the mutations that would allow her to have a targeted therapy. But she was tested for all those things, and she really just didn't respond. Now, that doesn't mean that it's not going to work for somebody else.
Right.
And it doesn't mean that somebody else shouldn't do it. But it just says that everybody is not going to respond to it. So
we're going to come back to talk about the initiatives of Team Draft and what your sort of protocol is to get the message out to people. Dr. Horn, we've heard an amazing story of passion, of energy to give back, to educate people in the community about lung cancer. Doesn't necessarily have to only apply to older patients with a smoking history who may or may not have been screened. What do you feel about this whole message that Chris is trying to get across? As a medical oncologist, you've got somebody here who's a huge advocate. What's your thoughts on all this?
I think it's a really important message, and I think that one of the things that he stressed is it's not about prevention. Because I think the more we just focus on prevention, we're going to have that stigma associated with lung cancer. Lung cancer is not just a disease of smokers, and quite frankly, even if you smoked, it's not like you should deserve to get lung cancer. That's like saying a woman who takes hormone replacement therapy deserves to get breast cancer. No one deserves to get cancer. It is a devastating disease, and I think that the more we think about it and get the message out there that it really can affect everybody. I have patients from age 18 to 94 in my clinic, and cancer doesn't know race, it doesn't know ethnicity, it doesn't know gender, it doesn't know how much money you make. It really just devastates whoever gets that disease, and the more that we can get the message out there to advocate for lung cancer, the more money that we get for research for lung cancer. For every dollar breast cancer gets, lung cancer gets 20 cents. That's not enough for the #1 cancer killer in the United States. And we need more research, we need more advocacy, we need as much passion as we can get out there in the community to help all these patients and families and to help us make breakthroughs in science.
Hearing about what Chris is doing through Team Draft and the patients that come to you, once they get to you, they're already channeled into getting the right care, getting the most up-to-date treatment and analysis of their tumour with molecular testing. How can you, as a medical oncologist specialising in lung cancer, use Chris's passion and energy and message to get the right people from outside of your institution to people like you that can give patients the best possible chance to have good outcomes with their disease?
So I think an important part of it is getting the message out into the community. A year ago, a study was presented at a meeting showing that 50% of patients are still not being tested for the basic mutations that we have oral available targeted therapies that improve survival and improve quality of life. So it's not only getting the message out to the oncologists in the community, it's getting the message out to the patients, asking the right questions, using resources to get to the right centers where we can help physicians out in the community think about what's the best way to treat this patient to give them their best chance of survival.
And before we bring on Carly Ornstein to talk a little bit more about this whole situation with lung cancer, we've already heard that a lot of patients can get lung cancer who have no smoking history at all. Are there other issues that we should be looking at in the environment if it's not smoking? What is it? Is lung cancer becoming more common, or is it that we're just getting better at detecting it?
So the incidence of lung cancer isn't necessarily rising, but the incidence of never smokers with lung cancer is going up. And we actually recently published that data with Joan Schiller's group at UT Southwestern. And it definitely is our environment. Radon is one of the most common causes of lung cancer in never smokers. I often will tell my patients, have you tested your house for radon? We actually recently bought a house and found out the radon was high, and we made them treat it before we moved in.
Wow.
The environment that we live in, look at China. The incidence of lung cancer there continues to go up, and it is definitely has to do with the environment, our diet. We don't know all the causes of cancer, but the healthier we can be, the better our chances are.
When you diagnosed a patient with cancer, with lung cancer, and they have no smoking history at all, are they shocked by that?
They are shocked, and we go over all the different risk factors that could have caused lung cancer. But it's, whether they've smoked or not, it's a devastating diagnosis, especially and equally for those patients who say, well, I smoked for 10 years and I quit in my 30s. You often hear people, I had my first kid and I quit smoking. Mm-hmm. They're equally shocked of, what happened 50 years ago that now suddenly I have a lung cancer diagnosis. Mm-hmm.